So, and I bring all the greetings and best wishes to Dr. Shah, and that scoring topmost rank in AIIMS, All India Institute of Medical Institute, Dr. Saha, that AIIMS rank number 3 in critical care. DM critical care rank number 3, Dr. Saha, and how it was. I mean, really great to have this rank, and also a wonderful achievement and a great achievement to look into, and to talking to you also gives me a lot of happiness. Yeah, and it's a pleasure for me as well. And we want to know your background. We want to know from where you did your medicine, where you did your post graduation, and we want to know that.
I am from Kolkata. I did my undergraduate MBBS from Midnapur Medical College, which is a government medical college of West Bengal. I passed out in 2014. They completed my internship in 2015. I did my MD in anesthesiology from Kolkata Medical College from 2016 to 2019. I passed out last year, and I have been doing senior residency at the Government Medical College of Kolkata, NRS Medical College, since 2019, and I gave the competitive exams for DM critical care, the NEET SS and later AIIMS, and I secured a rank of 3 in AIIMS, and I got a rank of 37 in NEET SS.
Yes. And generally, people who do anesthesia, they end up in starting the practice. They want to do the practice and want to finish MDs over. Then you can do a lot of cases. There are plenty of cases as anesthetist you can choose. And where do you want to do a DM program?
Sir, I at the time of joining my MD anesthesiology course, I wanted to go into intensive care medicine from there only. So throughout my course, I read all about anesthesia, but I put out a specific time, at least once a week or twice a week, to study intensive care, the intensive care books, and to get me habituated with the type of questions that are asked, etc. So at the end of 2019, when I completed my MD, I did a few. I started my senior residency. I did a few cases outside, like you told, because that's the thing. And but I made sure that I did not compromise on my studies, because I always knew that the main aim was getting into a TM program in critical care medicine. That's what I wanted to do. So I joined SPEED. Obviously, I joined SPEED because I consulted a few of my friends who had done in medicine or in surgery. They had joined SPEED, and they gave a very good review of SPEED and care that you take of the students. So I joined SPEED, and I most of the time I'm dedicated to studying for the intensive care and less to practice and things. For the last 1 year I've done this. And
so how was your preparation? Can you share something about your preparation? What all you did for your preparation?
Sir, for preparation, I first of all I did the SPEED videos, the videos which are already available when I joined, and then I followed all the live classes. Once I did the videos, and the second time I did the videos and took the notes. I made a column that there were some the points that I need to mug up, because there were some of the things I need to remember just by cramming them up. So I highlighted them with a different color pen or like that in the notes, and those which are conceptually a bit difficult, which I needed to know from another source, another textbook, I marked that with a different color. And then beside the SPEED notes, I studied Washington's Critical Care of Medicine, the manual, and the trauma and the infectious subjects I did from O's Intensive Care of Medicine. O's Intensive Care Medicine, the part that is large, that is the textbook, so I could not do the whole thing. The parts which I need to study, that was guided me by Horish sir of SPEED. He guided me about the part that I need to focus, because reading the whole book, it will not be time efficient. And
okay.
I mostly relied only on the only on the classes by Horish sir and Varun sir, and I made notes on them, and also the Washington manual. Said Harish sir repeatedly said that to rely on his notes and to practice some MCQs, because MCQ practice is important, but not to give that much importance to the MCQs, because the questions in, as I found out in both NEET essays and mostly names, that the questions are conceptual based. The topics are the same. The topics are same, but the questions are not same. That the MCQ book, they're just the same question has been asked. This is not the pattern. So the question books, so the MCQ books that I did were the 150 to 200 questions are shared by SAR from speed that I did, and Sandeep Agarwal's MCQ on intensive care medicine that I did. And
Did you give all the mock exams, all the 5 mock exams?
all the 5 mock exams I gave,
AIIMS
and
mock exams.
all the 5 mock exams I gave, and both the AIIMS mock exams, both the and the June and the November AIIMS that I gave, that helped me to identify the picture-based MCQs. The picture-based MCQs, there are very few, both in NEET essays as well as in AIIMS. So those questions were asked in the mock exam also. It gave me an idea about how to use my time, the 90 minutes time that is in the AIIMS. So how to use my time, and which questions to leave and which questions to make a guess and answer. Because answer your inspirational video that one day before the NEET essays, that one should mark as many questions, because the marks division is +3 and -1. That helped me to realize that yes, I need to take some chances with the questions. So that was the preparation.
Really wonderful, and really wonderful. And so it's all set now. It's all set now for you to go and join AIIMS, All India Institute of Medical Sciences, and to your dream seat of DM critical care. And all that you want to achieve, you already achieved, and be happy. You're a happy man. And definitely, we love to have you as faculty in speed in days to come, and after you join. And I wish that and invite you to be a faculty team to contribute for NEET SS students or AIIMS SS students, any super specialty degrees, and any in the form of MCQs or video lectures, whatever you want to contribute, and you're most welcome to that.
Sure, sir. Okay.
And you want to say anything to the last few words, anything that you want to advise and to say to the aspirants of DM critical care aspirants?
What I want to say is that one should always try to follow the dreams, and because the dreams do come true. Because it was easy for me to give up after securing a rank of 37 in NEET essays, but I did not. But I knew that I could do better, so I continued to revise once or twice more, and I gave up, and I gave my best once again in the AIIMS exam. And between the two, I also gave my European Diploma of Intensive Care, the EDIC Part 1 exam, which I also cleared. So that gave me huge confidence boost. And so I think one should surround themselves with people who are making positive comments and always encouraging you. The family members, the friends, they are also very important. And to rely on the teachers, because that they have done what I am trying to do, and they know what strategy will work. So that is very important.
And I once again wish you wholeheartedly all the best and all the success as to be in a great career, Saha, to be in a great career in DM critical care.
Thank you, sir.
God bless you, and to have wonderful years ahead.
Thank
yes,
you, sir.
All the wishes from all the faculties from the entire institute to you.
Thank you, sir.
Bye-bye. Thanks for joining. Have a great career ahead in DM critical care. Thank you very much. Bye.